So today we're going to talk about facial injuries, which is most commonly, which we see in practice, happens with children when they run around the playground or they bump into something, they bump into some table at home or they fall down. They get cuts on the forehead, on the eyelid, under the chin very commonly. So the parents are always very anxious. They don't know what to do. So they bring the child to the hospital. As plastic surgeons, we are specifically trained in making sure that these injuries are sutured or repaired in such a way that they leave the best possible scar. Always the parents will have a question, can't we put glue, or there should be no scar? Well, it's impossible to not have a scar because anytime the skin breaks, it always heals with scarring. What is in our hand is we can give it a good scar, and after the suturing is done with fine sutures, the scar can be modulated such that it fades, or we position the scar in such a part of the face or such an orientation that the scarring is good. The other thing is with glue, it's useful only if the skin breaks, if it's like a tiny cut. When the child bangs himself against a hard object, usually the skin is pressed between the bone and the hard object, so even the muscle gets cut. So in those situations, glue doesn't work well. It leaves bad scars, and of course there are still no long-term studies showing the safety of glue in such situations. So anytime you see anybody with small facial injuries, small cuts on the face, always insist that you need to see a plastic surgeon who can manage these injuries, because such scars on the face can haunt you for a lifetime.